I want to ask about this T2 centers that they're talking about now.
Okay, fine. Let's skip those. This is given to us by WHO Empower system, which means monitoring the tobacco use and prevention policies, protecting people from the smoke, that is the second-hand smoke, the third-hand smoke, and now the fourth-hand smoke. Then you have offering the help to quit tobacco use. This is the major dental task force for which we have formed these TII units all over the country. Johns Hopkins and Bloomberg Foundation in US, they grant India and Southeast Asian region a grant of almost $650 million a year to just eradicate the menace of chewable form of tobacco. Then W stands for warning about the dangers of tobacco, that is about the advocacy policies as far as the pictorial signs on the tobacco cartons are concerned. Enforcing the ban on tobacco, advertising, promotion and sponsorship, and R stands for raising the taxes so that tobacco, kind of the sale of tobacco or the point of sale of tobacco is reduced. Well, coming to the pharmacological option, we have the pharmaco and logical. So I have split it so that the logical aspect means it's more of behavioral counseling, which has to be always the mainstay of the skeletal system of any tobacco intervention initiative. Next, please. I'm thankful to Madam for this virtuous. Yeah, generally the theories we believe we call facts, and the facts we disbelieve we call theories. So this is like something like whether to jump into this bandwagon of tobacco intervention initiative. Why should a dentist do it? What is the lucrative aspect to it? Because nowadays people are into DSD, digital smile designing, implants, zygomatic implants, laminates, veneers, thin ears, compound ears. I mean, they fetch a lot, but what can you do as far as your tummy is concerned, your vitamin M is concerned, and how you can, contribute to the social system as a dentist on board. So this is the vicious relapse and remission cycle which we are thinking about. You have increased craving, abstinence procedure produces withdrawal, then nicotine use. Again, the patient goes back into this vicious cycle. Now, for this, you need to understand the trans-theoretical model of any patient before you start the counseling. So now that details I won't go about because it's a pretty long session. We do it for 2 days. So I'm trying to concise only the pharmacological component. Next. So here you have the pharmacology, environment, the sociological principles, the psychology and the genetics which play a role in tobacco addiction. Next. Next. Yeah, next. So you have 3 to 4% patients who do it on the willpower. So that supposing a patient comes up front to you and tells you that I want to stop tobacco, he can do it